Hi, my name is Jessie Miller, and I'm going to be talking about how evidence-based practice is used by a current nurse. So the nurse that I interviewed was Sylvia Pickett, who is actually my aunt. She is now the current educator at Mercy West Hospital. She had 10 years first on the medical surgical unit just as an RN. She then also had experience in surgery as an RN, also as manager in the surgical unit. I then asked her, in her own words, what evidence-based practice was, and she quoted saying, using research and detailed facts to deduct the best procedures to guide patient care. We then discussed if she was exposed to any evidence-based practice teachings while she was getting her undergraduate. And at first, she only got an associate's degree from Raymond Walters, which is a branch off of UC. She said that she had no exposure to any programs or classes or any teachings about EPP. But then when she got her bachelor's degree at Indiana Wesleyan, she didn't exactly have any classes about evidence-based practice, but she was able to get exposed to it, and a lot of her classes more talked about the research and the importance of it to patient care. We then talked about how evidence is now used to guide her patient care. She said in her beginning years, a lot of her decisions and procedures that she would do as a nurse were based on clinical experiences and judgments from herself and other nurses on the unit that knew what and what didn't really work for their patients in the past. But she said over the years, now more and more evidence-based practice was utilized in the hospitals to really guide the procedures and what they were now doing in hospitals, especially with the interventions. An example of evidence-based practice that she utilized in her unit was actually a new draining equipment that recently came out in the study that she was given on her unit to try out. This wasn't based on any clinical judgments of actually in the unit, but overall countrywide, she said she was given to them so they were able to learn it and see how it was better used to extract fluid from the body. I then asked her how important was evidence-based practice to be learned by future nursing students. And she said in her own experience, evidence-based practice was important for her to feel more confident and backed up in the actual procedures that she was doing. Because before, with just her clinical judgment, yeah, it might work for some patients, like a lot of the qualitative data was being used back then, but now being able to use the quantitative data from all these research studies, she felt more confident and backed up that these interventions that she was now utilizing in the hospital were going to work for her patients, and it was going to lead to better patient outcomes. These are the responses about evidence-based practice that my current nurse, Sylvia Pickett, answered.